This is how I start my session. Most people, they start with the Swedish technique like Effleurage, and just to spread the oil. Our technique is not going to be allowed you to use a lot of oil, because you're going to be not control your movements and sometimes slip away, or you're not going to feel the fascia, because most of the work is going to be with the fascia. And this is how I start my session. I start with rocking my clients. If client come in and really frustrating and pain, so I calm his down, and I'm always let the customer know to deep breathing. Always focus on the breath. If any pain present, let me know. No need to be pain here. Most people think pain, it's a good stuff. You go through the pain and you release the tension. It's wrong, because your brain start blocking everything. So it's like a bank alarm system, security. It shut down everything down, and you're not able to release the tension. Okay, and restore the movement. So what I'm doing here, yes, I just let the customer know, just take a deep breath, and I'm rocking. I'm calming the rib cage. I ask him to take a 3 deep breath. Just see how the rib cage is raising up. If any pain present, is any pain?
No.
This is great. I'm gonna do only one side, this side for the camera purpose, but usually I do both sides. So I just walk around and see how's everything going on this side. Okay, so I'm just gonna place my hands here and rocking. I also can see where's any rotation in the spine. So like I said, I'm going all around and just see where's the tension is and how the breath is going. I come right above the head of the customer and do rib springing. It's really good, calm person down. I'm not pushing on the spine. I'm really gently work on that springing. Okay? Place my hand on the rib cage, and what I'm doing, do a little twisting, gently twisting. Like I said, I'm not pushing on the spine, more on the rectus spine. How's it feel?
That's good.
Is always ask the feedback from the customer, especially if this is a new customer. He just came in, you don't know what's going on, he don't know too. He never done any MRI or X-ray, but pain is present. You need to be really cautious and really pay attention to the customer and what's really going on with his body or her body. So, and you can feel a little bit clicking. It's okay. This is the thoracic area. The thoracic area is always, people get around it, spending time at the computer, so it's always open stuff. You feel comfortable?
Yes, I'm good.
Always ask if a person feel comfortable or not. And what we're doing, it's called twisting the spine, the thoracic area. We do not do anything like this in lumbar area. We don't want to twist to the lumbar area. Okay, so now we're gonna open. So after I check the whole tension in the body, see if anything not breathing right, everything not rising up, I'm gonna go to the lumbar area. The first one is it's called lumbar roll. What I'm doing here, I just place my hands like a tuning fork. Just get my fingers like that and put them together, and that's create this fork. Now I'm placing the side. Like I said, I do both sides. But for the camera purpose, I just do from right to left. But you usually do both. And client, take a deep breath, and when he's exhale, I push towards the camera this way. If I'm gonna do left side, push from left to the right. I'll also do this on the exhale, inhale. So exhale, and I push. How's it feel?
Good.
Sometimes you're gonna feel click, don't be afraid, but don't push hard. If person feel pain, always ask, do you feel any pain? Do you experience any pain? And sometimes when you release this area, person feel pain. That's mean the possibility of stenosis or spondylolisthesis. And this is really important to referral these customers, these clients to the doctor, or do MRI or X-ray. It's really important, okay? So like I said, I'm gonna do both sides, and you roll it. That's how you roll it. You roll it forward and backward, okay? So this is called lumbar roll. The next one from here, right from here, this is the transition. When one arm, my right arm come right in this sacrum, and I try to open that space in lumbar area, create a space on the breath. So you see, I don't apply any oil. If you apply the oil, you're just gonna be slide off of the skin, and that's not gonna be pleasant for a customer. How do you feel? You feel okay? So you see, I'm pushing this because you see my hands is kind of scoop that fascia, and I'm stay on it. You see, I move this whole body. If this is oil, you just slide off and slide in. This is more medical massage and manual therapy, so less oil, please. All right, so we open that space and take a deep breath. This is feel really, really great, especially for people who's sitting all day. How's it feel?
Very relaxing.
Good. If this is bigger person, you can come up with your forearm. You can grab that sacrum and use your other forearm and just push this way and create a lot of force. So my right arm pushing this way. I'm not pushing on the spine again, just that fascia, and my left one pushing down. So you see, I use my body weight, and this is really, really powerful. With every breath, I'm going deeper and deeper. How's it feel?
Really good.
Really good.
Yeah.
Always ask feedback and no pain. This is the rule of this technique. So you can go back and roll again. It's feel fantastic, okay? Now we can do another decompression of the spine. You come up here on the top of the table, and what you're doing here, you grab that sacrum with one hand. You can do with two hands. Just make sure you feel comfortable. You're not injure yourself. And what you're doing here, you just decompress. You're gonna feel one side is springing more than other. Just observe, and pay attention to this customer. Does that feel okay?
Yeah.
Always ask every movement. Okay, so sacral twist. This is what I call. We have a lot of ligaments up here, tendons. What we're doing here, we just released this fibrosis. It's a lot of fibrosis can be happening here, and like I said, SI joint pain. This is really important to ask the customers how you feel. So you place your dominant hands or non-dominant hands. It doesn't matter how they feel comfortable. I always place my dominant hand on the top, on the bottom, and the left one, my not dominant, go on the top. And what I'm doing here, I'm just springing this and gently twist. Just twist. Sometimes people experience pain. That's mean we have SI joint problems, and it can be chronic. It can be inflammation in this area. So be really gently, but this is really good technique. Okay, push the sacrum down, take a deep breath, and always follow the breath. You see, exhale, I'm getting more. I don't push against inhale, because that's gonna create some pain. How's it feel?
Very good.
And like I said, you do both sides. I'm using this side, but I usually you can go 360. You can go up here, but it's not comfortable for me. So that's why I'm gonna switch the side, okay? So this is what I'm doing with the lumbar area. Now I'm gonna measure those posterior sacroiliac bone. I place my hands, and what I'm seeing here, this finger, the left side is deeper, so we have little twist up here. I would like to correct this right away without moving to the top, to the thoracic area. What I'm doing here, I'm just lock this SI joints, and ask my client gently raise this hip up, the left hip up, and I scoop under his ilium, so front bone. Okay, let it go, and I just hold it. I'm not using the hook. I use my flat arm. Just gently start twisting this way. And what I'm doing here, I create the counterforce with my right arm. So I create this little twist, gentle twist. Is any pain present?
No.
Great, so no pain. And I take it to the first barrier. I feel it's not going anymore. So I'm not gonna push. I'm not a chiropractor. I'm not gonna do any adjustment. And I ask him to breathe and gently resist me and push this left hip down. So what he's doing, he's pushed this hip down and I resist it. And I create a little bit of counterforce with my right arm and really relax, let it go, and I twist just a little bit further without any pain. Okay, how's it feel?
Good, very good.
That's feel really good. Now I release it. I can do lumbar roll again just to see how's everything going. Another springing, another decompression, and that's feel fantastic, I believe.
Yeah.
Okay, and look, without any elbow work on QL, I know most therapists, what they do, they start leaning on this QL and digging those poor tiny quadratus lumborum muscles. Without this, it's already, I feel big relief. I feel there's more breathing here and it's more movements. Okay, how's it feel?
Yeah, very relaxing.
Good.